ThermaCare Advanced Back Pain Therapy, Hip Pain Relief Heatwraps, Heat Patches, 2 quart. Product details. Soothe your lower back and hip area with ThermaCare Lower Back and Hip Heat Wraps. Targeted heat therapy, specially designed to fit your lower back and hip area, now comes in small medium size, as well as large extra large, provides temporary relief from minor muscular aches and joint pains associated with overexertion, strains, and sprains, as well as minor pains associated with arthritis, allows you to move freely while delivering therapeutic heat to relax tight back and hip muscles, thin enough to wear discreetly under clothing, can be worn on the move during chores, when relaxing, or overnight. Heat therapy patches provide up to 16 hours of back pain and muscle soreness relief. Heating pad for back pain and hip pain. Targeted heat cell placement stays close to skin, providing heat exactly where you need it.
Heat patches for pain relief allow you to move freely while delivering therapeutic heat.
Heat wraps have larger adhesive area that's easy to readjust. ThermaCare Muscle Pain Therapy delivers heat deep into tissue. To use heat patches, make sure darker heat cells are placed toward skin. Single-use heat wraps thin enough to be worn discreetly under clothing. Directions.
Instructions.
Directions. Tear open pouch when ready to use. Place on pain area on lower back or hip with darker heat cells towards skin. If 55 and older, wear over a layer of clothing, not directly against your skin. It may take up to 30 minutes to reach therapeutic temperature. Adjust for comfort. Do not over-tighten.
Wear up to 8 hours.
Do not wear for more than 8 hours in any 24-hour period. Place wrap flat. Do not fold or bunch as your risk of burn is increased. Warnings. This product can cause burns. 55 or older, your risk of burning increases as you age. Wear THERMACARE over a layer of clothing, not directly against your skin. Do not wear while sleeping. Check skin frequently during use. If you find irritation or a burn, remove product immediately. Do not use. If heat cell contents leak and/or wrap is damaged or torn. For more than 8 hours in a 24-hour period. With pain rubs, medicated lotions, creams or ointments.
On unhealthy, damaged or broken skin.
On areas of bruising or swelling that have occurred within 48 hours. On areas of the body where you can't feel heat. With other forms of heat. On people unable to remove the product, including children, infants, and some elderly. On people unable to follow all use instructions. Ask a doctor before use if you have diabetes, poor circulation or heart disease, rheumatoid arthritis,
or are pregnant.
When using this product, check skin frequently for signs of burns or blisters. If found, stop use. If product feels too hot, stop use or wear over clothing. Do not place extra pressure over the product, such as leaning against hard surfaces, or wearing under tight clothing, a tight waistband or belt. To avoid increased risk of burns, remove product before undergoing any MRI, magnetic resonance imaging, procedures. Keep out of reach of children and pets. Each heat cell contains iron, approximately 2 grams.
Can be harmful if ingested.
If ingested, rinse mouth with water and call a poison control center immediately. If heat cell contents come in contact with your skin or eyes, remove wrap, rinse affected area with water, and seek professional assistance immediately.
Do not microwave or attempt to reheat, as wrap could catch fire.